Right now, COVID mandates appear to be making a comeback across the entire country, which really appears to be something of a, you can say, cosmic coincidence. Because at the very same time that the presidential election is beginning to gear up, well, it appears that various mandates are going right back into effect. Specifically, on a previous episode, we already discussed how colleges and businesses were bringing back various aspects of the mandates, such as the mask mandates, the contact tracing, obligatory COVID tests, and according to No College Mandates, which is a group that tracks COVID policies in higher education, they found that there are still over 100 colleges across the whole country which require students to be vaccinated in order to attend in-person classes. However, since we aired that episode just last week, the list of mandates has actually grown, given the fact that several large hospital systems, using a rise in COVID cases as their excuse, have also reinstated their mask mandates. These include United Health Services in New York, which is once again requiring masks for patients, visitors, staff, and doctors. Here was in fact a statement from United, quote, "Because of an uptick in COVID-19 cases, masks are once again required in all clinical areas at UHS Wilson Medical Center, UHS Binghamton General Hospital, UHS Chinanago Memorial Hospital, and UHS Delaware Valley Hospital, as well as primary and specialty care sites. The policy is in effect immediately for all patients, visitors, employees, medical staff, volunteers, students, and vendors." Then you have Kaiser Permanente over in California reinstating their mandates as well, although at this very moment, their mandate applies only to staff members and doctors. Although when they were speaking to a local California newspaper, well, here's what a representative for Kaiser Permanente said, quote, "We are still strongly encouraging masks for patients, members, and visitors in the hospital and medical offices in the Santa Rosa service area in response to this latest increase in COVID-19 cases." Then you have the University Hospital System over in New York, which has reimposed their mask mandate for anyone entering the premises, telling a local news outlet that, quote, "Effective immediately, mandatory masking is required by all staff, visitors, and patients in clinical areas of Upstate University Hospital, Upstate Community Hospital, and ambulatory clinical spaces." Then there is UMass Memorial over in the state of Massachusetts, which has now likewise reinstated their mask mandate, although, just like Kaiser Permanente, at this very moment, it only applies to staff members. That's among the hospitals that have reinstated it. Now, all these sudden reimpositions of the mandates has a lot of people worried about the possibility of another wave of lockdowns. And it doesn't help when you have government officials or government advisors, not only here in America, but in other countries as well, coming out and basically bragging about how well they have trained the population to obey COVID commands. For instance, over at the University of Pennsylvania, they have something called the quote-unquote nudge unit. It's essentially a group of people who use little psychological tricks to nudge society to act in a certain way that they deem beneficial. Here's specifically how they describe their work on their website, quote, "The nudge unit is the world's first behavioral design team embedded within a health system. We leverage insights from behavioral science to design, implement, evaluate, and disseminate scalable nudges to steer decision-making towards high-value care, improve patient outcomes, enhance public health, and increase health equity. No matter how effective a medication, protective a vaccine, or beneficial a lifestyle modification is, they can only improve health if clinicians recommend them and patients utilize them." This is where nudges come in. A nudge is a change in the way information is presented, or choices are framed that is designed to prompt, guide, or motivate good decision-making. A well-designed nudge will make the quote-unquote right choice the easy choice without restricting choice. Now, this right here is Professor David Halpern. He is the chief of the nudge unit, as well as a government advisor to the UK. And recently, he spoke with the Daily Telegraph publication, wherein he essentially said the quiet part out loud. Here's how that conversation played out. Quote, "While speaking with the Daily Telegraph's Lockdown Files podcast, Professor Halpern said that he is confident any future pandemic lockdown and compulsory mask edicts will be met with compliance because people have learned a new behavior and, in principle, you can switch it back on. The country had, quote-unquote, practiced the drill of wearing face masks and working from home and could redo it in a future crisis because people are now conditioned to do what they are told. Professor Halpern said that while fear-based messaging in general is not effective, he defended its use in extreme circumstances, choosing not to reference the mass protests that built across the country after the restrictions began in March of 2020. Then the conversation continued, wherein this nudge unit director went on to describe how the government can use visual cues to trigger certain behavior. Quote, "There are times when you need to cut through, particularly if you think people are wrongly calibrated. The professor said that messages on posters used throughout pandemic restrictions acted as visual prompts so that when you go into a shop or somewhere else, it reminds you, it cues, it acts as a trigger for the behavior. The professor said that this messaging encouraged mask wearing, meaning people felt quote-unquote naked when they forgot to put one on. Put it this way, he said, you would feel like, oh my God, I haven't got my mask. You feel naked, right? Once the public has learned a new behavior, in principle, you can switch it back on. You've got the beginning particularly of what is called a habit loop. If this has happened, then you should do that. That really felt like he said the quiet part out loud. And it's exactly perspectives like these, alongside a resurgence of these various mandates, and then also alongside the mainstream media's shifting focus towards more COVID cases, which has people really worried about what this upcoming election cycle will look like. Now, some states here in America are preemptively coming out against the mandates. For instance, Mr. Tate Reeves, the current governor of Mississippi, he said this in a recent statement, quote, Mississippians will not and should not submit to fear again. In the early days of COVID, there was understandable uncertainty. We did not yet know what we were facing. As the months unfolded, it became clear that there were two pandemics, a disease that was easy to spread and that was deadly for many vulnerable people, and a pandemic of fear stroked by, quote-unquote, the expert class that demanded total subjugation. And then likewise, you had the governor of Iowa issue a similar statement just yesterday, wherein she said this, quote, since news broke of COVID-19 restrictions being reinstated at some colleges and businesses across the U.S., concerned Iowans have been calling my office asking whether the same could happen here. My answer, not on my watch. In Iowa, government respects the people it serves and fights to protect their rights. I rejected the mandates and lockdowns of 2020, and my position has not changed. Then you even had President Trump issue a public statement on this matter when just yesterday he released this video.
The left-wing lunatics are trying very hard to bring back COVID lockdowns and mandates with all of their sudden fear-mongering about the new variants that are coming. Gee whiz, you know what else is coming? An election. They want to restart the COVID hysteria so they can justify more lockdowns, more censorship, more illegal drop boxes, more mail-in ballots, and trillions of dollars in payoffs to their political allies heading into the 2024 election. Does that sound familiar? These are bad people. These are sick people we're dealing with. But to every COVID tyrant who wants to take away our freedom, hear these words: we will not comply. So don't even think about it. We will not shut down our schools. We will not accept your lockdowns. We will not abide by your mask mandates.
Now, in order to get clarity on what the federal government's actual plan is, well, we here at the Epoch Times, we reached out to the CDC in order to get concrete clarification regarding all these various mandates. And they actually got back to us. Here is what a spokesperson for the CDC told us via email. Quote, hospital admission levels are currently low for more than 96% of the United States, but the agency recommended that transportation workers, travelers, passengers, and others get the COVID-19 vaccine before they travel. Anyone may choose to wear a mask in crowded or poorly ventilated indoor areas, including on public transportation and in transportation hubs at any time. The agency also doesn't currently have any mandate in effect, and the CDC's advice for individual and community actions around COVID-19 are tied to hospital admission levels, with the, you can say, tacit implication being that if hospital admission levels for COVID reach a certain level, it's possible that we would indeed see a return of the mandates. Very cool. If you'd like to go through any of my research for today's episode, I'll throw all my notes down into the description box below this video for you to peruse at your own leisure, which I will mention is that same description box right below those like and subscribe buttons, both of which I hope you take a moment to smash so this video can reach ever more people via the YouTube algorithm. Now lastly, you might not know this, but on the very same day that Joe Biden was sworn into office, by some magical coincidence, on that very same day, YouTube made the decision to demonetize our channel. Since January 10th of 2021, we have not been able to run ads before, during, or after our program, and the super chat feature has been magically disabled. Now, every few months, on the back end of our channel, I appeal their decision, which for the past 3 years, that appeal has always been rejected. And the reason for their rejection is that some channel associated with our account has grossly violated YouTube's policy. They never tell us which channel, which piece of content, and which policy. Furthermore, every single one of our channels receives the very same message, meaning that every channel gets denied monetization because the YouTube system says that one of the other channels violated a content policy. It's beautiful how that all works. And so, if you'd like to support the journalism that we do here at the Epoch Times, if you'd like to support our work, well, the best way to do so is to subscribe. And in fact, this month, of which today is the last day, the Epoch Times has actually extended their awesome sale. Just 25 cents a week for the whole year, which, if you do the math, works itself out to just be $1 a month. And so, if you've been on the fence about subscribing to the Epoch Times, but you know for sure that you're definitely looking for an honest source of news, well, perhaps take the sale as an opportunity to try the Epoch Times for yourself. That way you can get unlimited access to everything. All the phenomenal documentaries, the videos, the movies, the infographics, the deep analysis, the awesome articles, the great newsletters, and also I'll mention that I publish somewhere between 1 and 3 exclusive episodes of Facts Matter over on Epoch TV. So if you'd like to watch some extra episodes of Facts Matter every week, including a huge backlog of exclusive episodes that we published over the last 2 years, you can find it all over there. I'll throw a link to the sale page. It'll be right there at the very top of the description box below. You can just click on that link and head on over and try the Epoch Times for yourself. And of course, you can cancel anytime, but I'm sure that you won't. I'm sure that you will love it and continue to subscribe for years and perhaps even decades to come. And then, until next time, I'm your host, Roman from the Epoch Times. Stay informed, and most importantly, stay free.